Okay, we're going to go through a pouch change today. So whether it's an ileostomy, colostomy, or a urostomy, the pouch change steps are all basically the same. So the first thing you want to do is get all your supplies together before you take anything off. So you have a choice of a one-piece system or a two-piece system, meaning the skin barrier and the pouch, they come apart and they snap together here. This is typically used post-op, so the doctors have easy access to the stoma. After that, then it's really per patient preference and body requirements. So this is a one piece, they're connected. It's just a little bit more flexible. And then a urostomy pouch has a spout at the end. So you have all your supplies together. These are the two choices down in distribution you can order them from if they're not on your cart. I also have a barrier ring, scissors, I like to use a Sharpie, some skin protectant if you need it, and some wipes. So the first thing you do is you're going to want to pull the pouch off. Adhesive remover is helpful sometimes. You want to push the skin down as you pull the pouch away. Once you have that off, then you can grab some of your wipes. Now we usually like to get a few of these wet, just damp. All you need is water. You do not use any of those barrier wipes. They like the perineal wipes, they often have barrier cream in that, and then that can leave a residual on the skin, and the pouch just might not stick very well. So just tap water, that's all you need. So we clean the skin. You don't have to clean the stoma. The important thing is cleaning the skin. So you want to make sure it's clean and dry. So a little bit of wet one and then a dry one, okay? I usually leave some right nearby because it often drains while you're working. But once it's clean, then I take a photo, which is always helpful if you can manage it. Then we're gonna have to size this. So I take the measuring guide. Measuring guides are inside the two-piece pouch. And we take a look, let's see, this one. So this one, it looks like it's about 1.5 inches. So we're looking for a size that is just a little bit bigger than the stoma itself. You do not want it rubbing up against the stoma because that can cause it, that can irritate it and can bleed a little bit. So 1.5. I'm going to take the skin barrier. You can either just follow the line on there, but I like to trace it on so I can see it a little bit better. Sometimes it might be next to a midline incision or a drain, so then we offset it. It does not have to be in the center. So sometimes I'll offset it like this. So either one of those is fine. And you take a scissors, that's the starter hole for cutting. I'll do the offset one just to show you. We usually use the suture removal kit scissors. And if this is the exact size you want to cut on the outside of the line, the mark. Okay, I'm gonna check to make sure I like what I've cut. So ask yourself, is it rubbing up against the stoma anywhere? So I look at the base, because some of them can be mushroomy. You really wanna look at the base. It's a little tight, so I'm just gonna cut it just a little bit more, right there. And check. Oh yeah, that's good. So in general, you don't want to cut it. You cut it about 1/8 of an inch bigger, but it's not a exact science. It's more like arts and crafts. Okay, so you have that ready to go. If it's drained, you might want to clean the skin one more time, or even just give it a dab around there because stomas can be quite moist. And then if there is any irritation, that's when you would use a little bit of skin protectant on there. Just wipe a thin layer is all you need. Less is more with these. Usually dries within about 20-30 seconds. So by the time you go for your barrier ring, it's usually dry. So the barrier rings are our preferred next step. Some people don't use these, but if you don't know, we highly recommend using them. You can get a better seal. They kind of work like a gasket. Old school is stoma paste. This can be very messy, and I just want to say, if somebody really wants to use it, you would only put a small bead of paste right around the opening. That's it. Don't put it all over the backing. It is not a glue. It's just, this would be more like caulking, okay? But barrier rings are much easier to work with, and it's much easier to clean up. So this is our preferred product. So you take both protective coverings off. It's stretchy and sticky. Doesn't matter which side you put down. And then you stretch it to about the size. If you get it too big, you can't stretch it back. So then you would pull it apart and then wrap it around, making sure everything is flat. If the abdomen needs to be flattened out, lay them down, flatten it out, and then overlap. That's it. Then you grab the skin barrier, take the protective covering off. These are just there for like a Band-Aid to hold on to, so you don't have to hold on to the sticky part. I like to dog ear these, so I can pull it off easier. So now I get it close. I kind of hover, center, and then apply. Run my fingers right around the center first, work my way out, making sure everything is flat. If you get a few wrinkles in the tape, that's fine, as long as everything is flat on the abdomen. Like a wrinkle like that is fine. Okay. Also like to run my fingers underneath the flange. Okay. Then you grab the pouch, line it up, snap it together, put your fingers underneath there to give it a snap all the way around. So make sure, I usually check this a couple times just to make sure everything is closed good and tight, especially down at the bottom. That's where most people miss it. Okay, so hopefully you positioned it correctly in the way that you want it, usually off to the side, so it's easy access for the nurses to empty. If the patient is emptying it themselves, then you would have it straight up and down on the patient so they can empty it easily, because it does not move once you get it in place. If the system balloons up with air, you can easily grab one of these tabs, open it up, press out the gas, and snap it back together, essentially burping the pouch. Because if you don't release the gas, it will push out the stool alongside the skin barrier. And then how you empty the pouch, this clear tab right here, roll it out, empty, clean, just some paper towel, whatever wipe you have, doesn't matter here, a couple inches in, definitely clean out the outside, and then roll it back up. Really important to make sure you feel the Velcro hooks hooking. Okay, I like to check that out. Okay, that's good. So a whole pouch change should be done once every 3 to 4 days. If it's leaking, of course, don't wait, change it. And empty the pouch when it's 1/3 to 1/2 full. Just don't let it get too full because then you'll have leaking problems. And that is a pouch change. Thank you for your attention.